Welcome to the Attention Deficit Disorder Expert Podcast Series by Attitude Magazine.
Hello, my name is Annie Rogers, and on behalf of the Attitude team, I'd like to welcome everyone to today's ADHD Experts webinar on the topic of sleep, one of the most prevalent and perhaps underappreciated problems associated with ADHD. In fact, roughly 70% of children and adolescents with ADHD report problems with sleep, whether that's bedtime resistance, falling asleep, staying asleep, all of the above. And all of those, of course, impact daily functioning. Poor and inadequate sleep can exacerbate inattention, emotional dysregulation, overall quality of life, and more. Here to explain the connection between ADHD and sleep and to offer cognitive and behavioral strategies to address these problems is Stephen Becker, PhD. Dr. Becker is an associate professor of pediatrics in the Division of Behavioral Medicine and Clinical Psychology at Cincinnati Children's Hospital Medical Center and the Department of Pediatrics at the University of Cincinnati College of Medicine. Dr. Becker has authored or co-authored more than 175 publications on ADHD, sleep, and sluggish cognitive tempo in children and adolescents. He's the editor of ADHD in Adolescence, Development, Assessment, and Treatment, and a joint editor of JCPP Advances. Dr. Becker serves on numerous prestigious editorial and advisory boards, and we are incredibly honored to welcome him here today for this session. Before I officially hand over the mic to Dr. Becker, I do need to take care of just a few housekeeping items. Those of you tuned into the live webinar, you can download the slides at any time by clicking on the Event Resources section of your webinar screen. If you're interested in the certificate of attendance option, please look for instructions in an email. You'll receive that about an hour after we wrap up with the live broadcast. And if you're listening in replay or podcast mode, please visit attitudemag.com, search for podcast 351 to access the slides, webinar replay, certificate of attendance option, everything for today's session. And if you support the work we're doing at Attitude, we encourage you to visit attitudemag.com/subscribe. Sign up for Attitude Magazine for your family or to share with a teacher or loved one who could benefit from greater ADHD understanding. So without further ado, Dr. Becker, thank you so much for joining us today and for leading this really important webinar on sleep and ADHD.
Absolutely. Thanks so much, Annie. It's a pleasure to be here. And thank you, Attitude, for the opportunity and for the great work that you do. And so I'm going to be talking, like Annie said, on ADHD and sleep, specifically in children and adolescents with ADHD today. So ADHD and sleep has a very long history together. Restless sleep was actually one of the symptoms used to diagnose ADHD a number of decades ago now, back in 1980, when the current diagnostic system, the DSM-3, was in place. Because there was such a prevalent thing. And certainly the interest in ADHD and sleep has only increased probably since that time, even though sleep is no longer considered a core or diagnostic symptom of ADHD. But we do know that the estimates really do vary. Studies use a wide range of different methods in terms of how do you assess sleep and what types of sleep problems are we talking about. But across the board, really sleep problems can affect anywhere from up to 70% of children and adolescents with ADHD. So certainly a highly prevalent co-occurring condition or issue that a lot of children and teens, and then by extension, their parents also experience. So some of the most common sleep problems across the board for children and adolescents, and certainly within ADHD as well, are listed here. So you can think about insomnia. So this is having difficulty falling asleep, even if you're going to sleep at a later bedtime. Often this comes with early wakenings as well, early in the morning, and not being able to go back to sleep. Sleep onset associations. So this is thinking about the child who really has to have their parent in bed with them to be able to fall asleep, or has to have a certain stuffed animal. Or for a teenager to have the TV on in the room, to have that noise that they've associated sleep with something else in their environment or in their sleeping room. Bedtime resistance, the child refusing to go to bed or the parent finds it difficult to set bedtime limits. I'm having some of this right now with my own 3-year-old who gets into bed. We have bunk beds newly in place, and he likes to climb out of them. So I am experiencing this a little bit myself currently. Sleep-related anxieties. So really thinking about anxieties that maybe are being carried throughout the day, or even if there's anxiety specific to sleep in terms of worries around darkness or other things that it might be in the sleep environment, or just anxieties or worries that throughout the day get placed in our minds, and then we have a hard time falling to sleep. And the deep sleep phase refers to the child falls asleep really late from what we would expect based on typical circadian or developmental patterns, and then by extension has a really hard time waking up in the morning or wakes up much later in the morning. We often see this, especially in adolescents, because they have to get up usually early for school, but then on the weekends, they often will delay their sleep and when they go to bed, but then also on the weekend days, get up at 10 in the morning, 11 in the morning, or afternoon. So specifically, when we think about ADHD, what causes sleep problems in children with ADHD? So there's a host of different factors that contribute, and we really don't have a great sense, by and large, of what really is predicting sleep problems in children with ADHD. We have some ideas, but we need much more work looking at these things together as well. But biological factors seem to play a role, that there are similar neurobiological pathways involved in the regulation of sleep, attention, and arousal, and some twin studies indicate that sleep and ADHD have some similar genetic underpinnings. Comorbidity is very common in ADHD. So on the internalizing spectrum, we think about anxiety, depression. Externalizing, we think about oppositionality or aggression, other behaviors. Those are pretty strong correlates and predictors of sleep problems. Medication is a very common question that comes up. So we know that medication can increase the risk of sleep problems. We'll talk about that a little bit later. But it's also really important to know that there is a number of studies show that medication is not the only reason that teens and kids with ADHD have more sleep problems. That even if you take a sample of kids and teens without taking any medication or they're medication naive, they've never taken medication, they're still more likely to have sleep problems compared to their peers without ADHD. And then there's numerous other environmental factors that can also play a role. So parental mental health, family environment in terms of family conflict, and then things like homework difficulties. So I work a lot with middle schoolers or high schoolers who the parents frequently will comment that their teen they realize that night that there's a big project due the next day. And so they're staying up all night to work on that project or running out to a store to get supplies, or that there's just homework that goes later into the evening than probably is ideal or probably it should, which then it has to then restrict how much opportunity there is for that child or teen to get some sleep. So once a child has sleep problems, again, we don't have a ton of great evidence around this. We know that some teens and kids with ADHD, those sleep problems will resolve either on their own or through intervention. But we also know that for at least a sizable subset of children, those sleep problems will persist in those kids. By the time they get into adolescence, we know that teens with ADHD are more likely than their peers without ADHD to get insufficient sleep on school nights. So getting less than the recommended sleep duration, which we'll talk about a little bit later as well. We also found in that same study that teens with ADHD were more likely than their peers to report doing all-nighters, so staying up all night. We don't know exactly why that is, in terms of whether that's they're playing video games or they're working on homework or they're having a hard time falling asleep, but certainly that's going to impact their school functioning the next day. And then we also know that youth with ADHD have more variable sleep behaviors. So historically in the sleep area, we've really focused on sleep duration, sleep onset latency, or how long it takes to fall asleep, or night wakings. And we've really focused on overall global measures of how long someone is sleeping. There's increasing interest on variability. And so a teen who goes to bed at 8 one night, 10 one night, midnight the next night, that's the same as the teen who goes to bed at 10 o'clock every night. But we know that there's a lot of variability. And what does that variability mean, not only for sleep, but also for daytime functioning? There's a lot of data starting to come out regarding that. So in one of our studies, this is just a couple of examples of what I mean by variable sleep. This is specifically in teens with and without ADHD. So just to orient you to this figure, this is sleep duration. And the black line, that black squiggle is a teen without ADHD. That gray line is a teen with ADHD. And those gray bars going up and down, those are weekend evenings. And so you can see that there is, for that comparison kid, that kid without ADHD, you can see that, yeah, of course, as we'd expect, there's some variability in terms of their sleep duration on any given night. But it really does range from about 8.5 to 10 hours of sleep. So kind of right in that range, but we would expect and hope that teens are getting on a typical night. If you look at that gray line, that's an adolescent with ADHD. You can see that there's much more variability. And so this teen is getting anywhere from 7 all the way up on, it looks like one Saturday, getting 13 hours of sleep. And really that does have a major impact on functioning. This is just a similar figure showing similar variability in different teens with and without ADHD in terms of their sleep quality. So their overall rating of how their sleep was the night before. And we do know that sleep problems are not only relevant to the night, but they also impact functioning during the day. And so that's when we really do start to think about referring and thinking about ADHD and how we treat ADHD as a 24-hour disorder. So it's not something that only shows up at school, only shows up at home, or only shows up at sleep. It really does influence all aspects of functioning throughout the day. Studies have shown that sleep problems do predict poor quality of life for kids with ADHD, as well as worse, harder parent mental health. And so those of you who are parents or have heard the anguish of parents know that if you have a child who has a really hard time sleeping, that's going to contribute to parenting stress, your own ability to sleep comfortably at evening, your own ability to take care of other things that you need to do as well around the home or for work. We've also shown that poor sleep impacts academics, includes academic performance, organization, and also lower grades based on report cards that we've acquired from schools and college institutions. We've also shown in some of our work with young teens that even after we account for a teen's initial levels of depressive symptoms or oppositional behaviors, that those teens who had sleep problems went on to experience an increase in depressive symptoms and oppositional behaviors over time. So one of the most frequent questions that I get is, okay, these things are associated. Do we really know, this whole chicken and the egg question, do we really know if it's sleep causing ADHD or ADHD causing sleep problems? We need far more studies out there addressing this important topic. We did one study to try to get at one angle of that question in terms of if we experimentally manipulate sleep, what does that do to a teen's attentional and behavioral functioning? So I'm going to walk us all through this figure here. This was our experimental sleep protocol. So this was done in the summer months because we wanted to make sure that our sleep protocol did not interfere with a teen's actual performance at school or actual grades or things like that. So the first thing we did is we know that the summer sleep schedule can be pretty variable and different for teens compared to their school year schedule. So we wanted to mirror the school year schedule as much as possible. So all teens went through this 3-week protocol where the first week, what we call the phase stabilization week, is we really try to mimic their schedule for the school year. So we'd say, okay, what time would you need to get up during the school year to get to school on time? For a lot of our teens, that was around 7 a.m. So we'd say, okay, for the first week of this study that you're going to be in it, you're going to wake up at 7 a.m. as if you were going to school. We're not going to tell you what time to go to bed because that's what happens in real life. Whatever time you go to bed or you and your parents decide, whoever decides in your home that when you go to bed, just do that for the first week. But we're going to set that initial phase stabilization in the morning. And then there's that counterbalance you see. That's the randomization. So in the experimental design, all of our participants either got shortened sleep or extended sleep, but we manipulated and randomized in which order they did that condition so that it could really have a causal claim in terms of the findings that we had. So if we follow up, this first team gets randomized. First, they're going into that top row, so they're going to do sleep restriction first. So in that second week, we're going to change their bedtime to allow 6.5 hours in bed each night. That's comparable. We chose that number for a reason. That's comparable to what a fair number of teens in general get on a typical school night when schools are in session. And then for their third week, that's the sleep extension week. We're going to shift their bedtime to allow for 9.5 hours of bed at night. We know that the teen sleep satiation, what that means is when someone is fully rested, but not overly rested, is right around 9.2 hours. And so we set that, thinking it's going to take them a little while to fall asleep. We wanted to get as close to that 9-hour mark as possible. So just to make sure that this is clear, let's take an example teen. Their first week down at the bottom, they're going to wake up at 7 a.m. that first week. Their bedtime, that's up to them and their family. They're going down on that bottom row, so they're doing sleep extension next. They're still going to wake up at 7 a.m. for all 3 weeks, but now their bedtime is 9:30 p.m. Then their third week, they're going to go to sleep restriction. Their wake time, once again, 7 a.m., but their bedtime is now 12:30 in the morning. And we had an amazing staff and coordinators who we would text reminders. We would ask the families, how are we going to help you do this? How are you going to remember? So we would text teens, we would text parents. We'd do wake-up calls early in the morning during the summer for some of these teens as well to try to make this study happen. So what we found was that during sleep restriction, we found extremely clear evidence that teens had poorer daytime functioning. Not only were they having a harder time waking up and feeling more sleepy during the day, but they also had more severe ADHD inattentive behaviors. They also had more sluggish cognitive tempo symptoms and oppositionality. They also had more depressive symptoms and poor emotional functioning as well. I do want to make one point is that we did not find effects on anxiety, by and large. We also did not find effects on ADHD hyperactive impulsive symptoms. So this is really important in that it shows that sleep might have some specific effects on more depressed mood and lower positive feelings, as well as inattentive behaviors. So ADHD inattentive as well as sluggish cognitive tempo behaviors, but less so on the hyperactive impulsive behaviors or anxiety symptoms. So now that we've talked about the prevalence of sleep in ADHD, as well as some of the impacts, what can be done to help? What can we do? So we really like to think, and Penny Corkum has done some really nice work in this area, really nice to think about using a stepped approach to treating sleep. And so you can see here's this hierarchy. So first, really thinking about psychoeducation. So just learning about sleep, learning about how sleep works, how the body handles sleep and manages sleep. That's great. We know for most individuals, and certainly for most individuals with ADHD, that's probably not sufficient if they really have significant sleep problems going on. So we move up. So we go up to really training and teaching about healthy sleep practices, which we'll talk about some of that in just a few minutes. For a lot of people, that can be sufficient, that you learn more about sleep practices, you actually implement them on a regular basis, which is a little bit more difficult to do, but that can really shift kind of not only sleep, but also how you feel the next day. And then also specific behavioral sleep interventions if additional things are warranted. And then lastly, medication. So this is medication, not thinking about ADHD, medication for ADHD, core ADHD symptoms, really medication specifically for sleep. This should be and is pretty rare in terms of if you do the things below this on this pyramid, ideally, very few individuals will need medication, kids and teens specifically for their sleep. And so like I mentioned, it is really encouraging that a lot of sleep problems do respond pretty quickly to behavioral interventions. So we'll go over some sleep practices and interventions in a second. And if you or your child or your teen are able to consistently implement even some of these, there's a really good chance that you will notice a difference pretty quickly. This isn't a type of interventions, by and large, that you need months of treatment or even weeks of treatment. Sometimes some quick targeted treatment can work. When I was in residency at Cincinnati Children's Hospital, I worked in our behavioral sleep medicine clinic. And a lot of the interventions there, the model is one 90-minute session where you get a good assessment of the sleep problems going on, targeted interventions. Some families will need some additional supports and follow-ups, but many will not as well. We do know that there are also aspects of ADHD that can impact healthy sleep. So going back to one of my earlier points, where we know that there's a lot of different comorbidities and other environmental factors that might contribute to sleep, as well as stimulant medication treatment. So this is really important if someone is assessing for sleep in a child or adolescent with ADHD, or treating or thinking about treating, trying as much as you can to get a thorough assessment to understand how might these different factors be contributing, because that will give you additional information in terms of where to focus your efforts. In terms of trials that have been conducted, it's been really nice. It's just been in the last 5 to 7 years where we've had the first randomized trials really even seeing, okay, if we have kids with ADHD and sleep problems, does that improve not only their sleep, but also their functioning? So the first one here by Kashavartzi and colleagues was done in 2014. You can see they had 60 children with ADHD, 40 of whom were randomized into the intervention group, the others to a comparison group. This program, they went through a 12-week sleep training program, which is the longest one of the ones here of the current trials. And they did find benefits in sleep, as well as encouragingly benefits in psychosocial health. Hiscock and colleagues in Australia in 2015, they published a very large trial in the BMJ where they had 244 children with ADHD, with half of those randomized to intervention. The intervention included a much shorter intervention, so 2 sessions plus a phone call, kind of a booster consultation. And they also found improvements in sleep, psychosocial health, as well as they also looked at working memory and found effects in working memory in their study. And then Penny Corkum in Canada did a really nice intervention with 61 ADHD, as well as other children with neurodevelopmental disorders, 31 of whom were randomized to the intervention group. This program was implemented across most, if not all, of Canada as a kind of a distance sleep education. So parents really were able to go in and kind of work through modules on the sleep education. And then I think there was some coaching involved in that intervention study as well. And once again, found improvements in sleep and psychosocial health. So we do need more studies. You can tell that these studies used they each used very different approaches and lengths to treating sleep, as well as different ways of measuring sleep. And also some of the outcomes 6 months later were pretty modest, or they weren't able to assess longer term outcomes. And so that's certainly an area where we do need a lot more. But the overall consensus from these is that if you take a child with ADHD who also has sleep problems, there's a good chance that you can not only improve sleep, but also that we'll notice improvements in their psychosocial and daytime functioning as well. These studies were conducted with school-age kids. We were really interested in also looking at sleep in teens with ADHD. And there are a few reasons for this. One, we know that sleep problems tend to increase in adolescence by and large, right? This is pretty common. We know that after puberty and during puberty, there's a lot of shifts to their circadian and biological system that impact sleep. We know that teens then this shifts their circadian phase, which means their biologic propensity is going to be to stay up later, which just makes it more difficult for them to get sufficient sleep, especially if they have an early school start time, which is very common in the United States of America, especially, although there are major shifts and momentum towards shifting high school start times currently as well. Also, on this slide, the trials that were done with kids with ADHD, certainly challenging to do, but often in kids, it's largely the parents who you're working with. You're often working on training the parents in terms of sleep hygiene or other behaviors or interventions. What can the parent do? And really the focus is on training the parent to then implement the strategies and behaviors. When you're working with teens, they have a lot more independence and a lot more control over their own sleep. We often work with families who, when I'm working with their teen, the parents are like, I have no idea what time they go to bed. Or I have no idea how long it takes them to fall asleep because they're in their room with the door closed and I went to bed 2 hours ago and my teen is still up saying they're doing homework or whatever they need to do. And so the parents are less aware and have less control over kind of the sleep behaviors. And so this was something that we really wanted to do. And so we recently completed a pilot open trial. This paper's under review, where it's a small pilot open trial. So what I mean by that is we had no randomization. So we can't conclude that there wasn't an effect of simply development or age, that it really was the intervention compared to not. But this is really the first step in what we hope is going to be the next, a larger scale randomized clinical trial that we'll do. And so we had 14 adolescents, like I said, it was a small trial, who completed a 6-session treatment in teens with ADHD who all had sleep problems. By sleep problems, the way we defined it for this study, they either had insufficient sleep duration per an actigraph, kind of a fancy sleep watch that we would put on their wrist as to determine kind of their sleep patterns. If they indicated really poor sleep quality overall, or if they had a marked evening circadian preference or circadian phase. That's how we define sleep problems. And so we enrolled them in a 6-session individual treatment, 50-minute session type of treatment. And we did find moderate to large improvements in sleep, as well as in numerous areas of mental health outcomes. So we did similar to what I mentioned when you restrict sleep, you find changes in attention and sluggish cognitive tempo. We also found that if we improve sleep, we also found improvements in parent and teacher ratings of inattention, as well as sluggish cognitive tempo. We did not find improvements on hyperactivity, impulsivity, or oppositionality. We did also then find improvements on depressed symptoms, but not anxiety symptoms. So maps on almost identical to what we found in that experimental study that we did a few years ago. We also found large improvements in daily life executive functioning. Most of these effects were also maintained over a 3-month period. The figure here, that's an overall index of sleep quality based on the adolescent report. This was our pre-registered primary outcome, which is why I'm showing that outcome specifically here. Higher scores is worse sleep quality. You can see pre-intervention. You can see the score being above 6, which is actually considered above a clinical cutoff for this specific measure. You can see post-intervention, on average, that's dropped down to about 4, with largely that being maintained 3 months later, which is really encouraging. On that same measure, if we use that cutoff, almost 3/4 of our adolescents were classified as poor sleepers on that specific measure before they had the intervention. and then 21% and about 29% 3 months later. So some encouraging findings that we then hope to, in the near future, follow up with a larger scale randomized controlled trial. So all of these interventions have a lot of similar components. So even though they vary in length, or if you're working with the teen or the parent, they all have some similar components that I want to go through. So really we think about the foundation. Here you can see this picture of this foundation. We're going to talk about that, some other sorts of components as well, but really if you don't have a strong foundation, everything else is largely going to fall apart, right? So think about those healthy sleep practices. This is sometimes also referred to as sleep hygiene. And it really is the first step, and it's often overlooked step, or sometimes it's dismissed as not being fully necessary, but it really is the foundation. These include things with routines, what we do, drink and eat, and when we do those things, thinking about light exposure, and also making sure that the body is ready to sleep. Basically, these are all facilitators, so that when the child or the adolescent actually it's time to go to bed, the body has done as much as possible to prepare them for success in terms of facilitating sleep. So some of the healthy sleep practices, first of all, trying to go to bed and wake up similar times each day. This is really critical for the body to get used to a sleep schedule. I showed you those figures earlier of very variable sleep patterns. And we know, especially in adolescence, we often see what we call social jet lag, where the adolescent is staying up much later on the weekends and then also getting up much later on the weekends. We call this social jet lag because it really treats the body. It's as if that on Monday, you are going to a different time zone 3 hours away, and you're doing that on a bi-weekly basis as you're shifting. And those of us who have traveled, especially if you travel internationally or across the country, you know that that is going to impact your concentration and your ability to function as well as you possibly could the next day. And so it's really hard to overestimate the importance of thinking about a consistent sleep-wake schedule. Daytime physical activity. It really does not only use up energy, it helps get the body ready for sleep. The one caveat with this is making sure that we don't want intensive or vigorous physical activity to happen really right before bedtime. So we don't want it too close to bedtime. So earlier in the day, earlier in the evening, absolutely. But you probably aren't going to want your child or your teen or yourself to be engaging in really rigorous physical activity and then 20 minutes later trying to go to sleep, because there will be so much arousal that your body will be experiencing that it'll be harder to fall asleep. Always a tricky one is that late night snacking. Again, this is something that I work with a lot of families, and the teens dismiss this one as something that doesn't really, that doesn't matter. But it really does in terms of thinking about avoiding meals too close to bed, as well as certainly avoiding getting out of bed to snack if you wake up in the middle of the night. Our sleep system, our food digestive system, our temperature systems, these are all very closely linked. And so you really want them to be in sync together, and eating food too close to bedtime or during bedtime or sleep really throws things off. You really want your stomach to learn to not go to bed hungry. We certainly don't want kids going to bed hungry. But we do want their stomachs to learn that, hey, when I'm starting to get hungry is when I'm going to wake up. And that's an internal cue to wake up in the morning and reset that sleep-wake schedule. This is one that everyone who is possibly listening to this has heard about in terms of avoiding technology as much as possible. Estimates range in terms of how we should avoid technology before bed, anywhere from 1 hour to 2 hours. And I'll be clear, we have so much work as a field in terms of better understanding the role of technology and sleep, and a lot of the things that we see in the news, I would argue are overblown or are kind of sensationalized. Because we don't really totally have a good understanding of how and why technology impacts sleep, or the extent or for whom it does. The main ideas out there being, first of all, that there's light from these screens, which really impacts the regulatory system, which certainly is a very valuable and key hypothesis for us to further test. There's also another hypothesis that simply, if you're playing video games or you're texting with your friends or things like that, that's just arousing, and that just is making your whole body feel more aroused, so that when you do turn off your phone or put it away, it's just harder to get to sleep. So we don't totally know, but we do know that overall best sleep practices are going to be as much as possible to avoid technology within 1 hour of bedtime, if at all possible. Having a calming bedtime routine. This is one of the ones that I really spend a lot of time in the teens that we work with in terms of, okay, what does your evening look like on a typical basis? Let's break this down in terms of, do you have extracurriculars? What nights are those? When do you get home? When are you having dinner? When do you actually getting your homework done? Do you usually have homework? What else do you have? Do you have piano lessons, or do you have other things that you're responsible for doing? And then thinking about, okay, if you're doing all of those things and it's a really jam-packed schedule, how can you and how can we work together to figure out a calming bedtime routine, whether or not that's 5 minutes to start with, or whether or not they have 30 minutes to create that calming bedtime routine. And so we really map it out step by step. We don't just say, okay, we're going to brush our teeth, we're going to have pajamas on. Okay, do you like to take your shower at night or your morning? We're going to map out, okay, what's the order that you're going to do these things? It really is thinking, if we get in the habit of this and the routine of this whole bedtime routine is going to really, like I said, facilitate the body to be prepared for as much successful sleep as possible. And then probably the second most important one that I really, especially with the teens that I work with, is using the bed only for sleep. And this has especially become probably even more important during COVID as teens are working on schoolwork more remotely. But we really want to think about the body associating the bed for sleep. So if you have a child or an adolescent who's watching TV in bed, or that's where they go to do their homework, or that's where they sit on their phone to talk or text with their friends, they're using the bed for all these other things, then when the child or the teen gets into bed, the body is not sure what it's supposed to be doing. It's thinking, hey, I could be in here to play video games, or I could be here to be doing my homework, or I could be here going to sleep. If you really focus on using the bed only for sleep, that becomes a very powerful cue that when you get into bed, your body will have cues of saying, okay, I'm in bed. It is now time to sleep. It's really about not sending mixed messages to your body about what the bed is for. So after all of those foundational pieces are in, which I can't emphasize enough, we then also want to focus on sleep-wake schedule. The first step of this is, what is the ideal schedule to allow enough sleep for the child or adolescent's age? Making sure that we at least leave enough time in the evening for that to be even a possibility. We know that the fall asleep time, how long it takes to fall asleep, can be unpredictable, but a consistent schedule is really important for your body clock to sleep. So like I've mentioned, timing the weekends as close to weekdays as possible. I'm not unreasonable about this, right? So if a teen's getting up at 7 a.m. for school, I don't typically ask them to wake up at 7 a.m. on the weekends as well, but I want them to wake up about 8 or 9 on the weekends. I really don't want them sleeping until 10 or 11 or past noon. And also thinking about a gradual approach. If you're trying to shift things, a gradual approach is often going to be better. And so if your teen is using technology right until the minute they're in bed or even after they're in bed, it's going to be hard for them to set all technology aside for the full hour before bed. So you might start off by saying, hey, when you get into bed, your phone is on the dresser away from your bed. And then next week, 15 minutes before bed, we're going to turn it off. 2 weeks later, 30 minutes before bed. Thinking about gradual, all of these things I've talked about can be done gradually as well. In terms of the sleep duration recommendations, in terms of making sure there is sufficient time, even possible, you can see on this figure here, if we're thinking about all the way from toddlers up to teenagers for the purposes of this presentation, you can think, obviously our early kiddos are 11 to 14 hours is recommended. Typically they're getting at least 1 or if not 2 naps a day. Then our preschoolers, we want 10 to 13 hours of sleep. They might also be getting 1 nap a day. School age, 9 to 11. This is in the blue. You can see the kind of turquoise color on the outsides. It could be appropriate for some kids, but the vast majority will fall in the blue. And then for teens, it's 9 to 11 hours. And we know that most teens are not reaching that threshold on a consistent basis. So let's briefly talk about naps and what naps do. So you can see this is an individual. They wake up around 9 a.m. and they've got this is very similar to your cell phone. You've charged your phone overnight. You've got a full battery power. As you go throughout the day, you can see that the bars are going down in terms of how much battery power you have left. And by the time 9 o'clock comes around, you need to charge your battery. This is exactly when this person should be going to sleep. And then as they're sleeping throughout the evening, just like your phone is charging, you can see that the battery life is increasing so that when they get up the next day, again at 9 in the morning, their batteries are again fully charged. Now let's take that same individual who the next day, they decide to take a nap. Okay, they wake up at 9 a.m., things are going well, their battery is getting drained. Around 6 p.m., they take a nap. What that does is that starts to recharge their internal battery. As you can see now, they've woken up from their nap, and where it's 9 p.m. and their battery should be on low, their battery now still has 2 bars. Their battery is not actually on low now until 3 in the morning. Then they're waking up the next day at 9 in the morning, and they don't even have a charged battery. It's just starting to get charged. So you can really see the impact, especially of a nap later in the day. So for a lot of our kids after school or into the evening, what that does and why for many individuals it makes it much harder than your body's just not ready for sleep then at your normal bedtime. It's harder to fall asleep, and then you have a hard time falling asleep, and you're going to have a hard time waking up the next day because your battery is not charged. Your battery is not charged the next day, you'll feel lousy and exhausted the next day, and then you're more likely in the afternoon and evening to take a nap again. And then the cycle repeats over and over and over. We also really want to think about independent sleep. So a lot of parents get in the habit of helping their child to fall asleep, right? Rocking them, reading to bed, kids will climb into parents' beds, or parents will fall asleep because they're exhausted in their child's bed. And over time, the child may learn to rely on this help in order to fall asleep. This is what we call sleep association. We also see this in older kids and teens. Often this might be, I can't fall asleep unless I have the TV on in my room. And I'm not even watching something on TV, but I need that sound or I need that light. They need something with them to help them fall asleep. And so thinking about gradually pulling those things away. So for a teen who has to have the lights on or the TV on, thinking about, okay, if we're going to do one of those things first, let's just turn the lights off in the room. You'll still have your TV light and the TV sound. Then the next thing goes, we'll turn the TV sound down a couple weeks later. And eventually, you're really a gradual process, so hopefully they are able to sleep independently. And then also managing sleep-related behavior. So getting to a child to go to bed can be a very common problem. A lot of stalling, a lot of excuses, and parents can really help here. And some example strategies that I'll mention are a bedtime chart, so a visual chart with clear expectations, reinforcement for compliance. That's going to be really nice. A lot of these you might think about a reward, even a simple reward that they can get the next morning if the last night's sleep went well. So this might be if you have two breakfast options and they prefer waffles over cereal. Hey, if you slept well the night before, you earned the waffle. Otherwise, you'll have cereal. Obviously, I want kids getting breakfast, but making sure that if there is something that is a simple reward that you can not spend extra money on, not spend extra time on, just build into the morning routine is a really, really nice way to address some of these things. And consistently then returning the child to the bed with very minimal interactions. You don't want to engage. They're going to want your attention at that time, and they're trying to stay up as later. So you're going to want to as quickly and efficiently get them back into bed as soon as possible. Another thing that can work really well, especially with younger kids, is a brief check-in and then praise. And so I mentioned earlier, my toddler currently is getting out of their bed when my wife or I put him down at night. And so I now, when he's down in his lower bunk, in the bunk bed, I'll go in just a few minutes later and say, awesome job, you're still in bed, great work. Do that a few times, and we've already seen improvements over the last couple of weeks, thankfully. And like many new skills, these take both time as well as consistency. And then relaxation and coping skills. So we know that especially if there's anxieties going on, whether that's sleep or other related anxieties, think about what are some relaxation training pieces that can be done. There's some nice things online that can train you to go through these. Or you could also go, if it's more significant, also finding a provider who provides cognitive-based or relaxation strategies, cognitive-based therapies, also facing fears. So this could be all the way from the parent sleeping under the bed to prove to the child that there are no monsters under the bed, thinking about what are games or other ways that you can creatively think about addressing fears, especially for some younger kids. Just briefly, I want to touch about stimulant medication and melatonin since it comes up so frequently as a question. So this is a study that we did a few years ago, but it matches a lot of the literature. You can see these are children who were with ADHD who went on low, medium, and high doses of methylphenidate stimulant medication. And you can see their trouble sleeping went up as dose increased. This is pretty common. However, another important thing from this study is we also looked at those who did not already have sleep problems before they went on medication. So they'd never been on medication before, and they had no sleep problems. You can see at the highest dose of medication of the trial that these children went through, we did see that about a quarter of them went on to then have sleep problems at the highest dose, which doesn't necessarily mean that was the best dose for these children. However, we also looked at those who had pre-existing sleep problems before they were ever put on stimulant medication. We also found that a fair number of those no longer had sleep problems at their highest medication dosage. So we do know, it's pretty clear that stimulants can produce insomnia. There aren't great data to suggest that there are substantial differences between the types of stimulant formulation. We also know that the main sleep disturbance that it is going to relate to is sleep onset latency, how long it takes to fall asleep. So yes, sleep should be monitored for any child who's initiating or changing doses. We also know it's critical to think about and assess if they already have sleep difficulties and what those are. And also to give it some time. We know that some of that initial difficulty falling asleep after a child's been stabilized on medication for a while, that generally seems to resolve and subside. Melatonin is a natural hormone that's created by the pineal gland, and it's stimulated by darkness. So darkness is a very, very powerful cue. So a very common sleep recommendation is to make sure that you get out, if the child or you can get light early in the day, whether that's through windows or going for a really quick walk, We know that melatonin is inhibited by light. So when darkness comes, and the melatonin makes us sleepy. Melatonin over the counter can be used in two different ways. The first as a chronobiotic, where it really is used to advance phase delay. This is not used nearly as commonly, and I'm not aware of any studies that have tested this in youth with ADHD. Melatonin is much more frequently used as a hypnotic, where really the goal is to help the child fall asleep more quickly, where 1 to 6 milligrams is typically used 30 to 60 minutes before the desired sleep onset time. And several studies have now shown that this does receive how long it takes a child with ADHD to fall asleep. A couple of things I think are important to know. Melatonin is considered a dietary supplement here in the United States, which means the FDA does not regulate its safety, purity, or efficacy. In some other countries, it is regulated differently and prescribed. There's also been some interesting work that has shown that melatonin supplements, they often have what's in the actual melatonin capsule differs from what it says in the label, whether or not it's a lot more melatonin than it says it would be or a lot less. And this is across different brands of melatonin, as well as some presence of serotonin. Like I mentioned, those studies have shown that melatonin by and large will reduce how long it takes a child to fall asleep. But melatonin studies have not found improvements in other areas of sleep or in a changing of core ADHD symptoms. As I wrap up, I do want to make sure to point you to some resources that are geared towards parents. These first 3 books are all geared towards parents around sleep for children, and we'll go over some of the things, but in a lot more detail that I talked about today. And then this last one, the book, The Sleepy Pebble and Other Stories. This is actually a really unique book that came out a couple of years ago by Alice Gregory, who is a colleague of mine over in the UK. And these are really stories that are for kids, to read to kids, or kids can read on themselves, that really are about sleep. And in the stories themselves, they have mindfulness-based sort of practices. And then there's things at the end that teach the parent a lot about sleep and different aspects of sleep as well to help promote sleep. If you're interested in learning about sleep in younger kids especially, I'll point you to babysleep.com. This is a nice online website where it goes through every month of life from birth up to, I believe it's age 3 years, so up to 36 months, where sleep experts provide guidance there. I do want to thank some amazing collaborators, both at Cincinnati Children's Hospital as well as at other institutions. Amazing team of research coordinators who have made any of the research that I have done possible, and certainly also would not be possible without funding from the National Institutes of Health, as well as the Institute of Education and Sciences, which is the research arm of the U.S. Department of Education. Feel free to reach out if you have questions or comments later, either by email. You can also find me on Twitter as well. And so now I think hopefully we have some good time for questions. I'm looking forward to hearing from you.
Wonderful. Thank you so much, Dr. Becker. That was incredibly informative. And yes, we do have a number of questions. Number one, without a doubt, is about melatonin. And specifically, a lot of questions regarding the safety of using that over a long period of time. So is there a certain number of years of using melatonin at which you should have some concern about long-term health impact on your child?
That's a terrific question, and it's one that does come up pretty frequently, especially given how many kids and teens with ADHD use melatonin. Unfortunately, the reality is we don't have great data. So melatonin is generally viewed as very safe and very acceptable. I want to be very clear that I'm a PhD. I am not a medical physician, so I want to be sure to talk within my scope of expertise. But the studies are pretty clear that melatonin it's safe, it's tolerable, it's acceptable. A lot of individuals with ADHD will eventually stop taking melatonin. Often that's because either they found it not to be effective as much anymore, or they found that it just wasn't needed anymore. But we don't really have great information on melatonin in terms of either in adolescence. We have far fewer studies in terms of how that in the body system. And we certainly don't have long-term studies looking at safety or efficacy over time. It's a great area of need. And I think it's similar to stimulant medications. Until more recently, we didn't really know the effect of stimulant medications over the long term. And certainly the area of melatonin has a long way to go to catch up to that area.
Okay. We did hear from a number of people who have heard, even from their doctors, which I found surprising, that concerns about impact on puberty, impact on depression, all sorts of concerns about melatonin. But it sounds like the research is not quite there to say yes or no. Is that accurate?
I would say that's pretty accurate. I think the research is just has a long way to go. I have heard some of those things as well. I will say in the small pilot open trial, a lot of the parents who came in, they were interested in their teen getting the treatment, not only to resolve sleep, but they had hopes that, like, okay, if we can think about behavioral strategies, then could my child stop taking melatonin because there was a motivation there. So I think there are understandable concerns. And anytime you're putting something in someone's body over time, you just have to wonder kind of what that's doing, especially if we don't have long-term studies. I do think it is concerning that you don't really know in general what's on the bottle in terms of how much, if it matches. I mean, some of the estimates in terms of the study that looked at this, it wasn't just a fraction of degree in terms of them being off. There were some wildly marked differences, as well as the presence of serotonin, which is somewhat alarming. And so I do think there's reason to be concerned. And I would just definitely say, consult with your physician. There is a recommendation that if you're able to get pharmaceutical grade melatonin, that might be more consistent. But especially because it's not regulated in the same way as medications by the FDA, we really don't know nearly as much about it.
Okay. Right. The another related question was regarding magnesium, and whether there's been any research to suggest that magnesium supplements could aid in sleep.
That's a great question. I'm not aware of any studies, but that doesn't mean that they are not out there. So I'll have to look into that. But I'm sorry, I don't know.
Okay. No, quite all right. Okay. So lots of questions about teenagers. And I think one of the primary ones is the use of reading and other sort of coping mechanisms to help perhaps quiet those racing thoughts at night that keep them awake. So we had questions regarding, is reading advisable? Reading on a Kindle, is that advisable? And what about listening to music and or podcasts?
Excellent question. So I tend to think about what's advisable. I don't have blanket statements. I think it really depends on the individual. And so I have worked with a lot of teens who music is definitely a thing, or that's part of their calm down routine. And so this is all part of my process of thinking about what is calming for this individual might not be calming for the next individual. And also talking about what kind of music or what kind of podcasts. I've worked with some kids and teens who reading a book puts them to sleep very quickly. That's what it does to me most nights. Whereas work with others where once they get engrossed in a book, or depending on what kind of book it is, that they will have a harder time falling asleep and they'll be reading into 2 a.m. I've worked with some who are doing crossword puzzles. It's very boring, or it's interesting, but not that interesting. So eventually they'll fall asleep, versus others where they just get really excited by doing that. Same with puzzles. And so I really think it's about, I don't have clear black and white, yes, do this, don't do this. It really does need to think about what is calming for an individual. And I think doing home experiments is a great way to test that out. So just say things like, for 2 weeks, let's try music. Let's see how then sleep thing, and we'll leave everything else the same. Let's try music, see how things go. Next 2 weeks, let's try books, see how that goes. And you can even track sleep during this time. It doesn't have to be fancy, just if you have a Fitbit, that's fine, but it doesn't even need to be something like that. Simply tracking your sleep as kind of a home experiment. In the sleep 6-week treatment that we do with teens, we do a lot of home experiments where we say, okay, try this. Let's report back next week and let's see how it went, what worked, what didn't work, to try to come up with what works as a good calming routine.
Excellent. A lot of questions regarding children and teens who have problems waking in the middle of the night and could benefit from some self-soothing strategies or other strategies to calm themselves back into sleep.
Great question. And so we really think about whether or not it's falling to sleep or a night waking. We really don't want any of us laying in bed for too long, because if we're laying in bed for more than 15, 20 minutes, then our brain goes on a different track and starts to think, I'm never going to get to sleep. I'll be laying here all night. What time is it now? Let me keep checking the time. And so for both kids and teens who have a hard time falling asleep, as well as adults, or they wake up in the night, if you find that they're laying there for 15 to 20 minutes, it's not a hard and rigid rule, but the guidance would be for them to then get out of bed, to keep the lights as low as possible, but then to do something kind of boring. And so often this might be a puzzle, or for some it is reading or getting out of bed. And then once they start to get drowsy and they're sitting in a chair, either reading or doing something different, so then once they start to feel drowsy again, to get back into bed, it will probably take some time before the body starts to associate that with getting back to sleep. But it doesn't really do usually anyone any good just be laying there looking at their ceiling for hours on end. And so that would be the recommendation is to get up. Water would be totally acceptable. Using the restroom, We wouldn't encourage evening snacking throughout the night or things like that, but that would be kind of the guidance that I would give.
Great. Yeah, we just had a question come in right before this from a teen who said, should I just lie there? So that's great. No is the answer. And this is just kind of a small point, but asked by quite a few people about, you mentioned not eating or drinking too close to bedtime. What would you consider too close?
Good question. I think in the hour to 2 hours before bedtime, I think is a good rule. I think if you think about ideally, if the hour before bed is when you can start to think, I'm going to start getting my body ready for sleep. And so that might not mean shutting everything off right away or starting your meditation or mindfulness exercise or whatever the case might be. But, just starting to get into a pattern. But I also think about gradual sorts of things. And so if you or your child or someone who you're snacking right before bed, you might just say, okay, now I'm going to try it for 30 minutes before bed. I think it's going to be harder to make behavioral change if you go to a drastic change and try to say, if after this webinar, if you go and say, I'm going to do all of the things that Dr. Becker talked about, I'm going to try to do all of these tonight and tomorrow night, you might succeed for like 2 nights, but it's going to be hard to, if you're not doing well in any of those domains now, to then all of a sudden completely change your sleep-wake patterns and schedule and habits, probably is not going to set you up for long-term change. And so thinking about what are 1 or 2 that you think are ways where you need to and could make some change now. And I really focus in on starting there and then adding additional changes or more changes as you succeed in the other domains. Wonderful.
And again, as you said earlier, using a sleep diary or another type of log to make sure you're tracking successes. Yeah. So on that topic, I guess, a lot of people facing resistance from their teenagers. The logic explaining the benefits of a full night's sleep are not having any impact on their behavior. And they're wondering if you have any advice for getting a teen's buy-in. That, this 9 hours of sleep really matters.
It's one of the most challenging parts in working with teens. It's also one of my favorite parts in working with teens, but it is a challenge. When we did our pilot trial, we were specifically interested in that. And so we developed a sleep kind of motivation to change measure because I was very curious about, hey, we'll have teens who will be enrolled in the study just because their parents think they have bad sleep, but the teen doesn't care, doesn't want to change. And I do think it's something where you can have the knowledge, but then actually implementing it at home is pretty different. We spent a lot of time thinking about what is motivating for that teen specifically. And so in that treatment specifically, we go over the empirical data that show not only great, some teens will be motivated by better academic performance and grades, some less so. Some will be motivated by better athletic performance. And so we show them studies where we show pictures and we show them information about, hey, if you're really interested in basketball or football, your performance is going to be better if you are well rested. For some, this will be vain, but we show them the studies that show them, your appearance, if you compare people who they are not well rested versus rested, for some adolescents, that's very motivated because by other observers, they will be rated as less attractive. And so we really try to think about what are different motivating factors. In addition to those things, I think thinking about what are things that are in the home that the family is doing that can be considered earned privileges based on certain behaviors. And so I would think about this beyond sleep, but also in other sorts of parenting and thinking about challenging child and adolescent behaviors in terms of if the child always gets TV or always gets video games or always gets certain things, okay, now you'll always get 20 minutes. And depending on how X, Y, or Z goes, you can earn up to an additional 30 minutes. You're thinking about things that are already in place that can be shifted in terms of thinking about that. It does become more tricky and can lead to initially more teen conflict. And so I want to be a little careful. And that's probably, if it gets to that point, that's what I would probably encourage seeking out some additional support or professional help and guidance.
Okay. Yeah, we do. Obviously, there is some comorbidity between ADHD and oppositional defiant disorder, which complicates things greatly if your teen is resisting and defying all strategies. And that's probably where it makes sense to get some professional help, right? One more teen question that came up quite a bit when you showed the graph of the ADHD teen sleeping up to 13 hours on the weekends. A number of parents wondering, I've always been told that they should catch up on the weekends. We should let them sleep in. So just to be clear, you're advocating for more consistency, and would you recommend actually waking up your teen at some point on the weekends if they're still in bed?
that might not help with the oppositionality, but I think it's thinking about the whole picture, thinking about, okay, if we are able to get the teen to have more opportunity for sleep during the week, that should be the first step, because then there shouldn't be as much of a need for catch up on the weekends. That being said, we know a lot of teens are going to catch up. And so similar to what I said, I'm not as rigid as if you wake up at 7 every day, you must wake up at 7 every day. If they're waking up at 9 a.m., especially if it previously was 10 or 11 a.m., I think 9 a.m. would be awesome. If they're sleeping until 2 p.m., getting up at noon on Saturday, I would say that's awesome. I mean, it really is where are you at now, and tracking the data now, and then where can you shift it? If someone's sleeping until 2 p.m., I'm not going to say wake up at 9 a.m. because that's going to lead to disaster. So I would say some sleep catch up on the weekends could be useful, but we also know that if you catch up too much on the weekends and you get too much sleep, you're really setting yourself up in the next week for Monday when you're going back to school for it to be really, really challenging. Because then if you're going to bed Sunday night late, you're waking up early again on Monday morning, that's when the cycle just keeps repeating. And then you're going to have a really rough week, and then you're going to want to sleep in the next weekend as well. And so it's trying to get that to be a little bit more matched, even if it's not perfectly matched, and less variable.
Right. It's that battery. Again, you want your exactly. You want your battery to be depleted on Sunday night at bedtime so that exactly. You're actually tired to go to bed. Okay, so what about waking up? This is a big challenge. Parents are saying even when they're mostly teens, but also kids, even when they've gotten sort of adequate sleep, getting them out of bed in the morning can be an inordinate challenge, more so than with a child without ADHD. Yeah. Any thoughts, advice on strategies for making the morning start a little more smoothly?
This is probably the motivation and piece, and then getting up in the morning are probably the two most difficult and most frequent questions that I get. The morning one is really tricky. I think parents are often in a rush in the morning. Everyone's frazzled. Everyone's a little grumpy. Everyone has to get out the door at a certain time, at least before the pandemic. But still, things school start at time, work start at time, things like that. And a lot of people are now getting back into the environment. I really do think about what are things that might be in place in home that can help a little bit. So it might feel babyish, but I've worked with families where I'm like, okay, unless you can show that you can get up, your parents are going to work with you the night before to pick out your clothes, which sounds like, why would you do this for a 17-year-old? Of course, no teen wants you doing that. And it really is showing okay, once we make steps towards that, you'll have that independence, but I need to make sure that you know that you're able to, that you can show me that you're able to do this. I do think breakfast options, if you have a teen who has a preferred breakfast option, they always want the Lucky Charms. They don't get Lucky Charms unless they get up with 2 or fewer reminders, or 2 or fewer. I mean, they shouldn't be snoozing, but they're going to snooze 2 or fewer snoozes. And thinking about otherwise, you're going to have whatever other cereal that they'll eat, but it's less preferred. And trying to think about those sorts of things as well. But again, that's something where it can lead to more difficult behaviors, and getting some professional assistance might be useful.
Right. Yes, this is an eternal challenge. It is a
tough one.
And just we're getting, more questions by the minute here. Just to underscore a point that you made, a lot of teens have gotten into the habit, especially in the last year, of watching TV in order to fall asleep. And I think your research is pretty clear that screen use, even if they're wearing, I guess the blue light blocking glasses are sort of a more of a thing now among adolescents. Even if they're wearing those, it's still not recommended for them to be watching screens.
Yeah, I would definitely say that that's the case. We really want to think about a quiet, cool, dark environment is what we know is most sleep promoting, both for going to sleep, but also staying asleep. So coming back to one of your earlier questions about waking up in the night, often we find that if we do a lot of things on the front end to help improve the calming routine and the good sleep environment, often we see those night wakings. Even though we're not directly targeting those night wakings, we often see that those naturally fall in line. But if you can set things up at the front end to go well, then often throughout the night it goes well as well. And so we would say, again, think about this gradually, depending on what the situation may be. but we would say definitely, hopefully try not to fall asleep with the TV on.
Got it. Wonderful. Well, Dr. Becker, we are out of time. Thank you so much for this very informative and practical webinar. We got a lot of great advice here for families in need, adolescents, children, but also adults. I think a lot of parents had a lot of takeaways for themselves. So thank you so much for that. And for those of you listening, thank you for joining us. If you'd like to learn about more of our upcoming webinars and also get updates on articles and research, you can visit attitudemag.com/newsletters and sign up for the newsletters that make the most sense for you. Thank you everyone for joining us. Thank you, Dr. Becker, for this great session, and we hope to see you again soon.
Thank you.
For more Attitude podcasts and information on living well with attention deficit, visit attitudemag.com. That's ADDITUDEMAG.com. That's ADDITUDEMAG.com. That's ADDITUDEMAG.com.